Whoever is working in medical coding outpatient departments like ED, ambulatory surgery, as well as observation coding, injection and infusion coding is very essential. From this week onwards, I am going to start multi-part series related to injections and infusions as well as chemotherapy coding. First, we will learn theory, then afterwards we will practice few scenarios. After watching complete session, if you like this session, please click on like button and also please share it with your friends. So without any further ado, we will start our learning now. So today's our topic is injection and infusion coding basics, as well as today we will learn chemotherapy coding part 1. In today's video, we will learn definitions, facility hierarchy, infusion, hydration, injection decision tree, as well as chemotherapy CPT coding. As our session name itself basics, we need to understand few basics related to injection and infusion coding. Usually these basics we will learn using the definitions. First, we need to understand what is chemotherapy. So chemotherapy is a type of cancer treatment that uses one or more anti-cancer drugs as part of standardized chemotherapy regimen. So most of the time, whenever in the documentation if we see chemotherapy, patient must provide chemotherapy for cancer conditions. Other than cancer, we can't code chemotherapy. During chemotherapy, patient will use one or more anti-cancer drugs. Or otherwise, in the documentation, you will see it as anti-neoplastic chemotherapy. As all of us know, cancer or anti-neoplastic, both are same. Anti-cancer or anti-neoplastic. So both are same words. So don't get confused. Anti-cancer and anti-neoplastic both are same. And in order to treat that cancer, patient will perform chemotherapy, where patient will use multiple cancer medications using the chemotherapy technique. So next one is infusion. So basically what is infusion? So infusion is the slow injection of a substance into a vein or tissue. Okay. So basically infusion is slow injection. So gradually in the using the drips, patient will perform the infusion. So now you might have a doubt. Then what is injection? So in infusion, patient will slowly inject a substance into a vein or tissue. Whereas in injection, patient will inject the substance into a vein in a single shot. So that is the difference between infusion and injection. Okay. Next, you need to understand therapeutic. So what is therapeutic? So therapeutic is relating to the medical treatment of disease or condition. Okay. For example, patient is having rheumatoid arthritis. In order to treat that rheumatoid arthritis, patient will perform therapeutic injections. Next, we need to understand push. Usually, we will call it as IV push. So, an IV push or bolus is a rapid injection of a medication. Okay, where physician will insert a syringe into your catheter to quickly send one-time dose of medication into your bloodstream. Okay, so basically, during the IV push or bolus process, physician will inject the medication into the catheter. Then directly that medication will lead to bloodstream. Next one is hydration. So what is hydration? So most of the time patient will perform hydration for fluid loss. Whenever patient is having any type of dehydration or burns, patient will perform this infusion of the hydration, where patient will inject small amounts of salt or sugar into patient's bloodstream in order to compensate dehydration. Next, we need to understand initial infusion. An initial infusion is the key or primary reason for the patient's encounter. Okay. So, what is initial infusion? The reason for the patient's encounter leads to initial infusion. Okay. Next one, subsequent infusion. So, infusion or IV push of a same substance or drug following an initial or sequential infusion. Okay. So, for subsequent infusion, most important keyword is same substance or drug. So this is the most important keyword. In the documentation, if we see, if the patient performs infusion of same drug after the initial infusion, you need to consider it a subsequent infusion. Okay. Next, sequential infusion. So this is also very simple. In sequential infusion, patient will infuse a new drug. Okay. So subsequent is same drug. So sequential is new drug after the initial infusion. So here same drug is the keyword. Here new or different substance or drug is the keyword. Okay. Next, concurrent infusion. So a concurrent infusion is an infusion of a new substance or drug infused at the same time as another substance or drug. So basically during concurrent infusion, patient will infuse multiple drugs at the same time. Okay. New substance or drug infused the same time as another substance or new drug. Okay. So here if the patient uses multiple drugs at same time, we need to consider it as concurrent infusion. Okay. So if anyone looking for same day surgery training, IPDRG training, HCC training, CCA certification training, please contact 707-526-3939. Now we will see facility hierarchy. So injection infusion coding hierarchy is very important. So this is simple basically. Hierarchy means what is the sequence of drug infusion. So sequence, otherwise we will call it as hierarchy. So chemotherapy, infusion, injection and IV push is the first to hierarchy. So whenever patient performs multiple procedure, you need to code chemotherapy at the first or primary service. Okay. Next, therapeutic, prophylactic or diagnostic infusions. Okay. Next, therapeutic, prophylactic, drug diagnostic, IV pushes. Next, therapeutic, prophylactic or diagnostic injections. Next, hydration. Next, intramuscular. Okay, now you might have the doubt. So what is prophylactic here? So basically prophylactic means in order to prevent future occurrence of any cancer or any type of disease, pre-disease process patient will inject the medication. So that one you will call it as prophylactic or preventive. So if you observe here, chemotherapy is first priority, then infusions, then IV push, then injections, hydration as well as intramuscular. You don't need to worry, we will see all these examples during our upcoming sessions. If you are unable to understand, please mention in the comment section of this video. Next, we need to understand decision tree. So decision tree is very important whenever you want to code chemotherapy, injections or infusions. Okay, so basically what is decision tree? So basically these are the steps whenever you want to code these infusions and injections. First of all, we need to check what is or why is the patient here, or what is the reason for patient's encounter. For example, here you need to check whether patient is coming for dehydration or burns or any type of cancer. Okay. For example, patient is coming for cancer. So you need to talk about chemotherapy. For example, patient is coming for dehydration. So you need to code for hydration. For example, patient is coming for rheumatoid arthritis treatment. So you need to code for steroid injections. So like that, first of all, you need to check why is the patient here. What is the reason for patient encounter? Okay. Next, what did the patients receive? Then you need to check in the documentation. During this encounter, what did the patients receive? Or what did the service provided by the physician? So that is the second step. So next, you need to check how it was given. Whether it is chemotherapy or whether it is infusion, injection, IV push or hydration or IM or subcutaneous. So this is basically approach, how it was given. Okay. Next, how long did it take? So this is very important for injection infusion coding. Always we need to check in the documentation what is the start time of the dripping and what is the end time of dripping. Okay. So we need to check here how long did it take. So here you need to check starting time and ending time. So what is chemotherapy, guys? So please mention in the comment section. So chemotherapy is the therapy which will be used by the physician in order to treat cancer. Okay. So in chemotherapy we have different types of variants. Intramuscular subcutaneous injections or intralesional, intravenous, intra-arterial or other. Okay. If the patient performs intramuscular or subcutaneous, these are the codes. If it is intralesional, these are the codes. If the patient performs intravenous technique using IV push or infusion, so these are the codes we need to use. If the patient performs intra-arterial injection, so or infusion, these are the codes. Other than these four, if the patient performs any therapy, you need to use these codes. First, we will see the chemotherapy codes, intramuscular or subcutaneous. So, intramuscular means here patient will perform chemotherapy treatment inside the muscle. Intra means inside, muscular, muscle or below the skin. So, subcutaneous means below the skin. For hormonal, we need to use 96401. For non-hormonal, we need to use 96401. For hormonal, we need to use 96402. So, those we will check in the CPT code book. So if you see our CPT code book, injection and intravenous infusion, chemotherapy and other highly complex drug or highly complex biological agent administration. Okay. So here we have an important guideline. Intravenous or intra-arterial push is defined as an injection in which the healthcare professional who administers the substance or drug is continuously present to administer the injection and observe the patient, or an infusion of 15 minutes or less. So what they are telling here, if you want to code IV push or intra-arterial push, here you have two criteria. Whenever patient perform this IV push or intra-arterial push, here patient needs to administer the injection and observe the patient. So then only you can code IV push or intra-arterial push. If the patient perform this IV push or intra-arterial push less than 15 minutes, you need to code it as IV push or intra-arterial push. So as we have discussed, we have two codes here, 96401 and 96402. 96401 chemotherapy administration, subcutaneous or intramuscular, non-hormonal, anti-neoplastic. Okay. 96402 chemotherapy administration, subcutaneous or intramuscular, hormonal, anti-neoplastic. So if you see this code description, anti-neoplastic means against the cancer or treatment for the cancer. Okay, so this is non-hormonal, this is hormonal. So in the documentation you need to check whether it is hormonal anti-neoplastic drug or non-hormonal anti-neoplastic drug. Next we have chemotherapy intralesional. So here you need to code based on the lesions. Okay, up to 7 lesions 96405, more than 7 lesions 96406. So if you see here 96405 chemotherapy administration intralesional up to and including 7 lesions. 96406 intralesional more than 7 lesions. Okay. So tell me now, so please mention in the comment section if the patient performs chemotherapy of 11 lesions, which code you will use. So please mention in the comment section. Next we have chemotherapy using intravenous route. In intravenous we have two codes, two sections, IV push as well as infusion. So for IV push, initial 96409, sequential 96411. We will check these two. So if we see here 96409 intravenous push technique singular initial substance drug. Okay. So during this technique, IV push technique, patient will inject or infuse only singular initial substance or drug, only single drug 96409. 96411 intravenous push technique, each additional substance or drug. So each additional. So this is new drug basically. Okay. So if the patient uses the new drug, we need to use 96411. So here total two drugs. 96409 if the patient uses the single drug. Okay. If the patient uses other drug also, after this initial drug, you need to use 96411. Why means, if you check the code description, I will push each additional drug or substance. So if you remember, as we have learned previously, sequential means new drug. Subsequent means same drug. So here it is sequential. So 96409, one type of drug, and 96411, different types of drugs. Next, we have codes related to intravenous infusion related to chemotherapy. So here we have 96413, 96415, 96417, and prolonged infusion. We need to use 96416. So these are the codes. 96413, chemotherapy administration intravenous infusion technique, up to 1 hour, singular initial substance or drug. So basically 409 and 40411 are for IV pushes. Okay. 4132, 417 are related to IV infusion. So 96413, chemotherapy administration intravenous infusion technique, up to 1 hour, singular initial substance drug, 96413. Okay. 96415, each additional hour. So same drug here, each additional hour. We need to code 96415. So mandatorily you need to give 96415 along with 96413 only. Okay. If you see here, report 96415 for infusion intervals greater than 30 minutes beyond 1 hour increments. Okay. So tell me now. So patient has injected one drug. Okay. Low, like 10 to 11 a.m. Okay. From again physician has injected same drug 11 to 11:15. Okay. How do we code this scenario? Please mention the comment section of this video. For example, sometimes in order to provide chemotherapy, physician may uses the pump also if it is more than 8 hours. Okay. So that time we need to use 96416. Initiation of prolonged chemotherapy infusion more than 8 hours, requiring use of a portable or implantable pump. In the documentation, if you see, so I have used chemotherapy drug administration more than 8 hours using portable or implantable pump. You need to code 96416. Next, 96417, each additional sequential infusion, different substance or a drug, up to 1 hour. Okay. So this 96415 for same drug, IV infusion of same drug. 96417 is for sequential infusion of different drug or new drug. So that time you need to use 96417. So see the guideline here, report only once per sequential infusion. Report 96415 for additional hours sequential infusion. So now we have intra-arterial push 96420, this one. So here we have single code chemotherapy administration intra-arterial push technique. So don't get confused. This is for intravenous push technique. 96420 is for chemotherapy administration intra-arterial push technique. So previously we have learned intravenous infusion. Okay, now we have intra-arterial infusion. So we have three codes here: 96422, 96423, 96425. So 96422, intra-arterial infusion technique, up to 1 hour. We need to use 96422. Okay. So next one, 96423, infusion technique, each additional hour, 96423. So tell me now. So please mention in the comment section. For example, if the patient has performed intra-arterial infusion up to 3 hours, how do we code? So please mention in the comment section of this video. Next we have 96425, infusion technique, initiation of prolonged infusion more than 8 hours, requiring the use of portable or implantable pump. That time we will use 96425. So this is for intravenous infusion, this is for intra-arterial infusion more than 8 hours. Don't get confused. Next we have few more scenarios: chemotherapy, other techniques, pleural cavity, peritoneal cavity, intrathecal and subarachnoid. We will see now. So 96440, if the patient performs chemotherapy administration into pleural cavity, requiring and including thoracentesis. So here we will not quote thoracentesis separately. Okay. So if the patient is having any type of lung cancer or any type of other cancer in the lung area, physician will inject 96 chemotherapy medication using 96440. Next 96446, chemotherapy distributed in the peritoneal cavity via implanted port or catheter. 440 is for pleural cavity related to lung. 446 is related to peritoneal cavity related to abdomen. So here whenever you want to code this, you need to check the location of the injection or location of the chemotherapy administration, whether it is pleural cavity or peritoneal cavity. If it is pleural cavity, 96440. If it is peritoneal cavity, 96446. Okay. Next 96450, chemotherapy administration into CNS, intrathecal, requiring and including spinal puncture. Okay. For example, patient is having any type of leukemia or any type of blood cancer. So physician wants to inject medication into the spine. Usually we'll call it as intrathecal, means inside the spine. So that time we'll use 96450. Okay. So here you will not code spinal puncture separately, as spinal puncture is already included in 96450. Next code 96542, chemotherapy injection subarachnoid or intraventricular via subcutaneous reservoir singular multiple agents. So basically this is the, for example, if the patient is having any type of cancer in the brain area, so that time physician will inject chemotherapy injection into subarachnoid or intraventricular areas of the brain. 96542. So thank you team. Thanks for your spending your time to learn injection and infusion coding. So if anyone looking for this training, please contact me using 707-526-3939. And also if you have any doubt, please mention in the comment section of this video. And if you like this session, please click on like button.